Bismillahirrahmanirrahim. In the name of Allah, the most beneficent, the most merciful. My name is Hafiz Muhammad Saeed Anwar. I am the student of DVM 10th semester, Faculty of Veterinary and Animal Sciences, Gomal University, Dera Ismail Khan. First of all, I am very thankful to my Allah who gave me the opportunity to complete my degree as Doctor of Veterinary Medicine. And now I am very pleased to present my presentation to my honorable teachers. Second station. My second station was Shuja Dairy Farm at Khanewal. Introduction of Shuja Dairy Farm. Shuja Dairy was established in 2003 at village Chak number 63 Tanar Khanewal by Mr. Shuja Aslam with aim of providing pure milk and milk products. They started with 50 crossbreed cows, now there are 336 cattle and 193 buffalo in farm. Total milking animal are 116 having milk production of 1400 liters per day. Herd size of Shuja Dairy Farm. Milking cows 80, dry animal and heifers 93, heifers 57, bull 8, calves 100, milking buff 36, buff calves 81, buff heifers 45, buff bull 4, adult buff 27. The total number in the herd is 531. Internship description: the farm was distributed in different departments. I worked in these departments: calf section, milking parlor, feeding department, hospital and breeding department. Calf section. Arrival of newborn calf. Calf arrived to calf shed with first feeding colostrum after the birth. At calf shed, feeding was according 10% body weight and first feeding done as early as possible. Temperature and standing position of calf was monitored during the feeding. Feeding of calf. First three feeding were colostrum, then move to the next pen and feed on transitional milk for until weaning. Female calf feeding. First three feeding with colostrum, nipple feeding system, hay and calf starter was given to the calves. Male calves. First three feeding with colostrum, male sail out after this. Air tagging. At the age of 30 to 40 days, air tagging of female calves was done. Disbudding. Disbudding is the removal of their horn or the process of preventing their growth. Disbudding was performed at the age of 21 to 30 days. Instruments required for disbudding are hair clipper, persa, while pink spray was sprayed on the wound. If bleeding occurred during the disbudding, camenophore used. Milking parlor. Milking management. Washing of teeth with tap water, pre-dipping of teeth with disinfectant solution, cleaning of teeth with disposable tissue paper, applying teeth cup on teats, switching on suction machine after milking teeth cups removed by itself, post-dipping in post-dip solution. Feeding department. Feeding department was headed by the farm manager. Feeding at Shuja Dairies comprises of different components. Some of components are the following: fresh fodder, concentrate, silage and mineral mixture. Section 4 was the hospital at the dairy farm. Animal health and management. During the observation, abscesses, pink eye for udder injury, any abnormal discharge from the vulva, diarrhea, front rear side. Animal sitting in the stall helps in diagnosis of metritis. Following cases were observed: mastitis, lameness, abortion, milk fever, endometritis, abscesses. Diagnosis and treatment: mastitis. Signs: for stripping of milking animal, presence of clotty, stringy or watery milk, redness, swelling of udder, and temperature 104 degrees centigrade. Treatment: IM antibiotic therapy. Streptomycin sulfate 5 gram, penbiotic 10 mg per kg. Combination of gentamicin sulfate and tylosin or enrofloxacin 4 mg per kg. Intramammary combination dexamethasone 2 to 5 mg per kg plus penbiotic 10 mg per kg plus gentamicin 4 mg per kg for mastitis. Fluid therapy to dilute the toxin. Stripping lessen the bacterial contamination toxin in the udder. Lameness. History: arch back during the walking or while standing, head jerking upward, forelimbs downward. Shifting of weight while standing. Treatment: hoof trimming was done. Green bandage, CTC sprayed, iodine. IM injection of oxytetracycline 10 mg per kg, NSAIDs like the meloxicam 0.2 mg per kg was given. Control: food dip 10% CuSO4 3 days a week. Hoof trimming at dry off and 120 day. Abortion: a cow aborted a fetus at the time of 7 months of pregnancy. It was a suspected case of brucellosis. We performed tests for it, but it was not brucellosis. We took a brain sample and sent it to UAS Lahore for the test of bovine Neospora. Neospora is a microscopic parasite believed to be responsible for the dairy cow abortion. Due to the lockdown, the test was not performed and no result given to us. A calf was presented with the swelling at throat region. On the palpation it was abscesses which was not mature. We applied choline poultice on swelling to grow the abscess, and after 5 days abscess became mature and we drained it. Milk fever. History: a cow was presented at hospital 2 days after parturition. Signs included the staggering, inability to rise, muscular weakness, recumbency, laying down, and subnormal temperature 98 Fahrenheit. Diagnosed milk fever. Treatment: intramuscular and subcut calcium therapy with dose rate of 1 gram for 45 kg. Calcium borogluconate 20 to 40% solution plus dextrose 350 to 450 ml IV. Control: vitamin D medication 8 weeks prior to calving, proper provision of dry matter and calcium in close-up period, close-up diet. Nuteric cap 140 gram per day, DCP 40 gram per day. Conclusion: according to my own opinion, Shuja Dairy Farm is the best because all type of learning facilities is present there. Skill learned: I have learned various important skills that are very much essential for a practicing veterinarian, including management, feeding, treatment, milking practices, artificial insemination, and cost management, etc. Acknowledgement: all the praises for Allah, the most compassionate and most generous, who gave me supremacy and compatibility to complete my professional degree, Doctor of Veterinary Medicine. I really appreciate my teachers and my parents for valuable guidance and criticism. I would like to express my gratitude to Dr. Irfan and Mr. Hamza, farm managers at Shuja Dairy Farm. Thanks to all FIWA's faculty members for their kind, sympathetic and inspiring guidance. I wish to express my sincere appreciation to our respectable and worthy Dean, Professor Dr. Shakibullah.